Bien, mesdames et messieurs, je vous propose de démarrer. Bienvenue à toutes et à tous. Welcome to be here. I will speak in French because Iveta will speak in English. Donc, bienvenue à ceux qui sont présents et ceux qui sont en distanciel. Nous sommes 300 et évidemment, on a une grande journée qui nous attend. Je vous propose donc de démarrer tout de suite avec trois anniversaires à fêter. Le premier anniversaire, c'est le centenaire de ce lieu majestueux qui a été établi dans trois visions. Une vision universaliste, une vision scientifique et une vision de paix. Cette cité universitaire internationale qui fête ses 100 ans, quand on voit un contexte aujourd'hui avec certains conflits, certaines difficultés, il nous laisse l'idée que finalement la science est l'endroit où on doit débattre et on doit faire avancer un sujet, et même les sujets les plus complexes doivent pouvoir avancer comme les interventions non médicamenteuses. Mais ce n'est pas le seul anniversaire. On en a un second anniversaire, c'est celui du mot que je me demande ce que vous faites là. Intervention non médicamenteuse est un mot négatif qui a l'air de faire penser que ce sont des anti-médicaments, alors que pas du tout. Le premier papier publié en 1975 traitait de la douleur et de l'intérêt d'intervention non médicamenteuse pour traiter la douleur. Et effectivement, la science avance, mais paradoxalement, on peut voir que lorsqu'on tape sur PubMed Drug, on a 7 millions d'articles. Quand on tape le mot ici chirurgie, on va avoir 6 millions d'articles. Quand on tape dispositif médical, on va avoir 1,5 million. On fait le pari, qui veut jouer? Combien on en a pour les interventions non médicamenteuses? 13 000. 13 000. Donc il est clair qu'on est dans un instant important sur lequel l'investissement dans la recherche d'une société savante qui a été créée, et c'est le 3e anniversaire, il y a 5 ans, après un travail qui a démarré, et merci Pierre Cochat, parce que c'est la Haute Autorité de Santé qui a mentionné ce terme intervention non médicamenteuse en 2011, et là où on a créé une plateforme universitaire pour se transformer avec un de mes maîtres, Henri Pujol, en société savante internationale, parce que les interventions non médicamenteuses, elles ne sont pas valables que pour les Français. Elles sont valables en fait pour tous les humains. Ce sont des pratiques immatérielles de prévention et de soins. C'est pas aussi simple que ça, effectivement. Elles sont protocolisées, elles sont fondées sur la science, mais il faut qu'il y ait une science qui soit spécifique. Donc c'est la raison pour laquelle on a créé une association loi 1901, une société savante à vocation internationale, parce qu'on a vu à quel point, finalement, il n'y a pas de partage, mais Iveta va y revenir. Et notre ambition, effectivement, c'est de partager les meilleures pratiques au monde entier, et que ces pratiques, elles ne soient pas figées, mais qu'elles puissent évidemment évoluer et les partager pour que on ait les meilleures pratiques dans les meilleures conditions, et le numérique va nous le permettre. Je voudrais remercier les plus de 13 000 adhérents à notre newsletter gratuite de notre société savante. On a été impressionnés quand on a ouvert cette newsletter d'avoir autant de personnes qui nous suivent, et on voit à quel point c'est pas qu'une question de Français ou c'est pas qu'une question d'Européens. Ces pratiques, elles doivent être partagées, et on est vraiment heureux de les avoir. Et je voudrais évidemment remercier tous les partenaires qui nous aident. En premier lieu, évidemment, l'assurance maladie, la Ligue nationale contre le cancer, la CNSA, qui nous aide à construire un référentiel numérique. Nous sommes une association de bénévoles, mais en même temps, nous devons fabriquer et recruter des personnes pour pouvoir faire tourner les systèmes. Et donc, c'est grâce à eux qu'on peut avancer. Et c'est grâce également à des complémentaires santé, parce que oui, bien sûr, il faut aussi que des complémentaires santé qui ont parfois remboursé sans trop regarder, vont peut-être demain et après-demain commencer à regarder d'un peu plus près ces interventions non médicamenteuses. Et toutes les sociétés savantes, je tiens ici à remercier Anne Villemain, présidente de la Société française de santé publique, d'être présente. Je tiens à remercier, je l'ai vu tout à l'heure, Éric Serra, qui est président de la Société française de douleur, également présent. Mais on a 32 sociétés savantes qui soutiennent notre mouvement collectif, coopératif et constructif. Donc à présent, c'est le moment de la présentation un peu plus détaillée du programme et évidemment d'honorer les personnes qui sont ici présentes, malgré des problèmes de transport ou autres, malgré différents problèmes. On est vraiment très heureux de les accueillir. Donc je laisse la parole à Iveta NAGYOVA, qui est responsable d'une unité de recherche de médecine comportementale et sociale à l'université Košice en Slovaquie. Elle a été également la présidente de l'EFA, l'Association européenne de santé publique, et elle est aussi la présidente de ce comité scientifique, Iveta NAGYOVA.
Thank you very much, Greg. Bonjour, mesdames et messieurs. Ladies and gentlemen, dear colleagues, please welcome to this wonderful event, the NPIS Summit 2025. And it's really my great pleasure to welcome you here and to be the chair of the International Scientific Committee, as Greg said, and also the honorary president of this association. So let me start with my presentation in English. And we would like to introduce to you a little bit the concept of non-pharmacological interventions, what was the history and so on. So the first, as Greg mentioned also in the beginning, the history of this term is not very long, isn't it? It started in 1975, but with some international institutions that recognize the term, it was the first one was the WHO in 2003, which published a book about adherence to long-term therapies, and there was the first mention of the term non-pharmacological intervention. The second one was, sorry, I just have to start my presentation. The second one was in 2008, the British National Institute for Healthcare and Excellence, and a couple of years later, also the French Haute Autorité de Santé introduced the term non-pharmacological interventions. In 2014, the Irish Department of Health contributed. In 2015, Public Agency of Canada. 2016, US National Institutes of Health and Japanese Ministry of Health, Labor and Welfare. 2017, Chinese Center for Disease Control and Prevention and Italian Istituto Superiore di Sanità. In 2018, Italian Council of Medical Research. 2019, the Spanish Ministry of Health. And 2020, the European Center for Disease Prevention and Control. And as you might assume, it has been related to COVID-19 pandemic, so they introduced the term at the beginning of the pandemic. Then we can continue with another institutions, and it was in 2021 the Belgian Conseil Supérieur de Santé, and 2022 the European Commission also started to use the term non-pharmacological interventions. This term is a very interesting one, and it's gaining a lot of popularity. For example, there was a publication in year 2020 in the Nature, a very high-level journal or high-impact factor journal, talking about pain and recognizing the power of non-pharmacological or non-pharmaceutical interventions. And also the WHO published an updated version of their publication or their recommendation for people with mental health, brain and health and substance use in 2023. And they are again using the term non-pharmacological interventions for people living with dementia. But now we come to a land of confusion, because the WHO also published in 2025 a publication when they speak about non-pharmacological intervention as population-based interventions, as mass media health promotion campaigns. And Sorry. And we can continue. So the problem is that we have no agreed evaluation framework, and there were 46 frameworks evaluated by Greg and his colleagues, and they found that there is really a lot of chaos, a lot of confusion, lack of understanding in the term non-pharmacological intervention. So there is a confusion with regard to approaches and disciplines, physiotherapy, traditional medicine. There is a confusion regarding protocols like Otago program, mindfulness-based restful intervention. There is a confusion regarding soft skills, hand washing, massage techniques, components. Does it include also virtual reality? And we can continue with biomedical products. Is surgery a non-pharmacological intervention? Do medical devices count as non-pharmacological intervention? Lifestyle interventions like vegetarian lifestyle, is this a non-pharmacological intervention? Professional attitude, empathy. Public health measures, are they really a non-pharmacological intervention when we speak about tobacco tax or health promotion campaigns? And also healthcare organizations, they are using the term non-pharmacological intervention for palliative care or even data management systems. So what are the consequences? The consequences are that because of this, we have weak transferability, traceability, and continuous improvement in non-pharmacological interventions, because every field, every professional is actually reinventing the wheel. They start from the beginning without a consensus and without universal definitions and a framework. And this has been detected by Greg and other colleagues in 2022. They started a study, a consensus and participative study, to look into more details, what can be done about this. So the phase one was elaboration of methodological and ethical invariants, and in this there were 17 participants who contributed, and it was the work of 1 year. In the phase two, there has been an improvement in the definitions with 300 participants, and it was a work of 4 months. I'm going into detail so that you understand that this process was very rigorous and that the outcome, therefore, is very valid. So in phase three, it was a vote with 503 participants and 2 months of work, and finally, the phase four was consultation with the scientific community, scientific societies, and also health agencies, and it was a work of 4 months, and I would like to acknowledge here in Sam, who contributed with financial support to this work. So what was the conclusion of this huge amount of work with so many public health so many professionals? It was the clear definition of the non-pharmacological intervention, the consensus, that it is evidence-based, effective, personalized, non-invasive prevention or care protocol registered and supervised by a qualified professional. So when we speak about non-pharmacological interventions, we talk about psychosocial interventions, physical interventions, nutritional interventions that we use for prevention, care, cure, or support. And the next step is the NPI registry, the registry of non-pharmacological interventions, and each intervention that we call non-pharmacological intervention has to have a clear designation to whom it is intended, the main health benefits, also what are the secondary benefits. It has to be clearly defined. It has to be clearly defined what are the potential risks, because there can be some risks. The mechanisms, how it works, why it works, the target population, the protocol, the detailed protocol, how you should perform the intervention, including the time frame, because it cannot be forever. It is a restricted time frame intervention. Who are the professionals who can perform the intervention, and also context of use. Some interventions cannot work in some context or so for some populations. So this definition was followed by a research framework to support all the work in the field of non-pharmacological intervention, which includes 14 ethical recommendations, 63 methodological recommendations, and when we go into details, it's 6 for observational studies, 6 for mechanistic studies, 9 for prototype studies, 28 for intervention or clinical studies, and 14 for implementation studies. And the main 5 characteristics of the NPI that it has to be clearly described, it has to be explainable, it has to be effective, it has to be safe and implementable. And of course, we are here in France, and I would like to really congratulate you with the work, and especially Greg and his team, what you achieved here. And we have representatives of very influential public health authorities here and French health authorities here who are supporting the work of non-pharmacological interventions. So here you are pioneers, and you understand why is it relevant, how it can benefit the health of populations and well-being. But we want to go further. We want to go beyond, and therefore we started to collaborate also at the European level. So we had a meeting with and presentation at the European Brain Council in November 2024. The ECRIN Research Network was in May 2025. We also had a presentation in Brussels in December 2024, and the ERA for Health Research Network presentation was an online event, but with a huge number of participants. Over 200 people participated in this webinar, so clearly there is a great interest in non-pharmacological interventions. And the next ones are also collaboration with international organizations such as the WHO, Department of Non-Communicable Diseases, Rehabilitation and Disability, the WHO Academy headquarters, because also raising awareness and capacity building in this field is very important. So we will hear more about the badges, how you can gain more training and education in the field of non-pharmacological interventions. The WHO Department of Maternal, Newborn, Child and Adolescent Health and Aging, and also UNESCO. And with this, I will finish my introduction for those who did not know what non-pharmacological interventions are, but I'm sure that because you are here, you probably are very familiar with that, but still it was important for you to understand, or we felt that we need to share with you our work. And with this, I would like to once again welcome you very much, and at the same time, I would like to draw your attention to Code of Ethical Conduct for NPI Summit participants. You can find it in your booklet. Please follow the ethical conduct recommendations. Very briefly, just about the program, From Science to Practice. Today, in this room, you are going to have a session. The first session will be on psychosocial interventions, then the next one on physical interventions, nutritional, and what is also very important, as you could see, is methodological and ethics. In the room Birmans, there are posters, and Gulbenkian, there are a lot of workshops and interesting sessions. So this is from me for the opening ceremony for the time being, and now I will give a floor back to Greg.